A patient presents with typically dry appearing triangular patches to conjunctiva with a layer on the foam on the surface, usually located in the temporal to the cornea. So here you can see in the diagram, this is the diagram of the eye. This is the foamy appearance of the eye, and this spot is called Bitot spot. Okay, this is called Bitot's spot. Okay, so this Bitot spot is basically the deficiency of vitamin A. So the nutritional deficiencies are very important in the FMG question. You will get 7 to 8 question related with the nutritional deficiency. So let's start with some vitamins deficiencies, in which first of all I will take the vitamin A deficiency as in the questions. Vitamin A, the xerophthalmia is the first sign. In the xerophthalmia, it is the first symptom. Okay, it is the first symptom, xerophthalmia, and the first sign is conjunctival xerosis. Okay, first symptom shows is the night blindness. Okay, patient symptoms are basically those things which patient complains and sign which we elicit. Okay, so the patient complains with the night blindness. Okay, so xerophthalmia is the stage where there is the dryness of the eye, in which the first symptom is usually the night blindness, and when we elicit the sign, we found that there is a conjunctival xerosis. Okay, the dryness of the conjunctiva. Most specific manifestation of the vitamin A deficiency is Bitot spot. Okay, and Bitot spot is more than 0.5% in prevalence, greater than 0.5% in prevalence, so it is called public health problem. If night blindness is 1%, more than 1% in population, that is a public health problem. Okay, so we are trying to do vitamin A prophylaxis program so that this prevalence should be reduced to that level that is not a public health problem. Okay, usually prophylaxis is given from 9 months with the vitamin A 1 lakh international unit. Okay, then 2 lakh international unit every 6 months up to the 5 years. So total 17 lakh international unit vitamin A should be given. And the treatment part is 0, 1, 14. So 1 is if it is less than 1 year child, we will give 1 lakh at the first day, second day, and 14th day. So total 3 lakhs. And if the child is more than 1 year, we will give the child 2 lakh international consecutive days, and the third dose on the 14th day. Okay, 1 lakh international contains of 13 milligram of vitamin A. Okay, 30 milligram. Or if oral is not able to, you are not able to give oral, you can give intramuscular dose. It is half of the oral dose. For example, 1 lakh, in place of 1 lakh you can give 50,000, in place of 2 lakh you can give 1 lakh. Okay, WHO classification of xerophthalmia is primary X1A, X1B, X2, X3A, X3B. Okay, X3B is actually chromatomalacia, and secondary changes night blindness, XN, XF fundal changes, and XS is sclerosis of the conjunctiva. Okay, now another vitamin deficiency is thiamine deficiency is called beriberi. Beriberi is basically of 3 types: wet beriberi, dry beriberi, okay, and mixed. Okay, so wet beriberi basically is of related with the heart. Okay, cardiac failure is there, and dry berry basically for the neuronal changes, nervous involvement. Okay, we can see here in the diagram, this is a dry beriberi. Okay, and this is the wet beriberi where the edema is present, CHF, congestive heart failure is there. Okay, sometimes due to the in the alcoholics especially, this vitamin B1 deficiency is there, which is called beriberi, called Wernicke syndrome, where there is a ophthalmoplegia, confusion, coma, and death can be there. Okay, another vitamin deficiency is vitamin B3 deficiency. Beriberi is from B1, and this is B3 deficiency is called pellagra. This is so many times asked in the FMGE that vitamin B3 niacin deficiency cause pellagra. Okay, this pellagra has 4D: diarrhea, dermatitis, dementia, and death. Okay, these are 4Ds. If 5D is included, delirium is also included, 6D depression is also included, and here dermatitis you can see there is a casus necklace appearance. Okay, casus necklace appearance you can see in the diagram. Casus necklace, the dermatitis of the neck region like this. Okay, this is the neck. Okay, so is the necklace like dermatitis of the neck, it is called casus necklace. Sometimes it is shown in the diagram image where ocean can be there. Okay, burning feet syndrome is by the vitamin B5 deficiency. Vitamin B6 deficiency is basically related with macrocytic hypochromic anemia, and vitamin B6 deficiency is also in the when we give ATT therapy, isoniazid therapy is called peripheral neuropathy. So we will give supplementation of vitamin B6. Okay, vitamin B6 deficiency also cause seizures in infants. Okay, vitamin B9, it basically the folic acid. Okay, this folic, if the infant is on goat milk, so it can cause folate deficiency, and megaloblastic anemia due to the folic acid deficiency, or in the periconceptual period, if folic acid deficiency in the pregnant woman, it is called, it can cause neural tube defect. Okay, so neural tube defect can be there if there is a folate deficiency. Okay, vitamin B12, megaloblastic anemia, pernicious anemia, peripheral neuropathy, subacute combined degeneration of spinal cord. Okay, subacute combined degeneration of spinal cord. Okay, vitamin C, we all know that bleeding of gums called scurvy. Vitamin D cause osteomalacia and osteoporosis in adult and rickets in children. Okay, so this should be remembered. This is very easy. You have also learned in the class 12, but when it is come in the questions in the exam, sometimes we forget the easy questions. Okay, another deficiency of mineral, that is zinc deficiency. Zinc deficiency causes acrodermatitis enterohepatica. Here the dermatitis of the skin of hand, especially because acrodermatitis, hands and legs, and enterohepatica is the involvement of the GIT tract. Okay, enterohepatica. Okay, liver and the intestine. The deficiency of essential fatty acid cause toad-like skin. It's called phranoderma. Okay, essential fatty acid, we all know that essential fatty acids are linoleic acid, linolenic acid, and arachidonic acid. Okay, these are the essential fatty acids. Okay, so in the phranoderma and zinc deficiency, both so alopecia, diarrhea, brittle hairs, and sterility, this can be seen in both. Okay, chromium deficiency called impaired glucose tolerance, because chromium and zinc is also part of insulin metabolism. So chromium cause impaired glucose tolerance, or zinc also cause impaired glucose tolerance. The selenium deficiency cause Keshan's disease. It is endemic cardiomyopathy. Also, the selenium is responsible for the sterility in males. Okay. Vitamin E cause progressive ophthalmoplegia and sterility. Now, there is a Codex Alimentarius, basically related with the food adulteration. Okay. Now, countries adopted FSSAI, Food Safety and Standard Authority of India. It is by the Ministry of Health and Family Welfare, Government of India. We see our food products in which FSSAI approved our logos are there. Okay, so our FSSAI is based on basically Codex Alimentarius of the world. Okay, so what is food adulteration? Food adulteration is whenever you are any impurities added in the food and it's called toxicity. It's called food adulteration. Okay, so one of the very important thing is letharism, in which the arhar dal, usually we all take arhar dal or tur dal. Khesri dal is very much resembling this arhar dal. We got confused and this khesri dal is consumed. This khesri dal contains a BOA toxin. This BOA is beta oxalate aminoalanine. Okay, beta oxalate aminoalanine, this is the toxin. So neuroletharism can be caused by this BOA toxin. It is most common in humans. It occurs more than 30% of dal is consumed over 2 to 6 months. Then if your diet if contains 30% of dal, so this called neuroletharism, especially affecting 15 to 45 years of age. Osteoletharism is most common in animals because it affects bones in animals more. Okay, there are some stages: latent stage, no stick stage, one stick stage, and two stick stage, and crawl stage. So that you become crippled after some time. Okay, initially it is a latent stage, then no stick, then one stick, two stick, and then you will crawl. Okay, because it is so painful, then you can not able to walk. Okay, Prevention strategy of this letharism is removal of toxin by the steeping method, parboiling, banning the crops, vitamin C prophylaxis, health education regarding the crops, and public health awareness and genetic engineering method. Okay, I have already told you about this very dry berry, wet berry, and Wernicke-Korsakoff syndromes. Okay, this is a riboflavin deficiency. This is called chelosis. It's basically due to the vitamin B2. Okay, this is casus necklace appearance due to the pellagra. Okay, vitamin B3. Okay, this I have already told the Codes Alimentarius. Okay, this Prevention of Food Adulteration Act is in earlier 1954. Bismarck, Eggmark, these were earlier used in our food products, but currently FSSAI is the new logo, that is Food Safety and Standard Authority of India, is used in all food standards. Okay. Now coming on epidemic dropsy. Epidemic dropsy is basically due to the sanguinary toxin. It inhibits the oxidation of pyruvic acid. The pyruvic acid is a very important component of the glycolysis. As a byproduct of glycolysis, and this pyruvic acid comes to the mitochondria and it comes in the Krebs cycle, gives you the energy. Okay. So when there is sanguinary toxin, this inhibits the oxidation of pyruvic acid, and this pyruvic acid, after that, all of the metabolism of the cell breakdowns. Okay. So this epidemic dropsy is derived from Argemone mexicana oil, because we usually take mustard oil when there is an impurity of Argemone mexicana oil. This seeds, Argemone mexicana seeds, contains toxin sanguinarine and is called epidemic dropsy. Okay. Paper chromatography is the most sensitive test to test this epidemic dropsy. So what are the signs, symptoms of this epidemic dropsy? Bilateral non-inflammatory edema, edema of lower limb, glaucoma, congestive heart failure, or death. Okay. So if from the epidemic dropsy, you can die also. Okay. Another is endemic ascites. Endemic ascites is basically caused by the pyrazolidine alkaloids. Okay. It is by the crotalaria plant. It is called Junjunia, usually in the MP and the central part of India. This crotalaria plant called endemic ascites. Another is ergotism. Ergotism is basically by the fungus called Claviceps fusiformis. And when this fungus infests the bajra, rye, sorghum, or wheat, these are the crops which are infected by this fungus, and it contains ergot toxin, cause ergotism. Okay. For to removal of the ergot, 20% salt water or air filtration method is used to remove this ergot toxin. Okay. Another toxin, aflatoxin, is also from the fungus by the Aspergillus flavus. Okay. And this contaminated aflatoxin can cause hepatocellular carcinoma. Okay. Especially this aflatoxin is found in the groundnuts. Okay. We all eat groundnuts. Sometimes it is infected by the aflatoxin and it can cause hepatocellular carcinoma. Okay. And other common relatant which is used in that, like brick powder, red color powder in your chili, red chili, dried papaya in the kali mirch, and lead chromate in haldi, cow dung in the coriander or dhania. Okay, these are the usually similar looking adulterant which can be used in the chili and the dhania. Okay. Another topic apart from the nutrition, I'm actually going very quick because there is some basic concepts of common things, so that I can cover all these things. Okay, you have already studied these things, but I am just here to give you a recall so that you can easily recall these all things so that you can attempt in your exams. Okay, so all are present at CSC except, so in the CSC surgeon is there, blood storage facility sometimes present when it is a CSC in FRU, it is present, and sometimes it is FRU as well. CSC, all CSC cannot be FRU, but some CSCs are FRU, so it is also a FRU is first referral unit. Okay. Then this is SNCU. SNCU is basically specialized neonatal care unit. It is usually in the district hospital or medical colleges. So in the place of SNCU, basically NBSU as the CSC. CSC contains NBSU, that is newborn stabilization unit. Okay. Okay. So some key factor about primary health care system in India, that is level of care, primary, secondary level of healthcare. Primary healthcare by the subcenter and the PSCs. Okay, we all know that there are norms of the PSCs and CSCs. The subcenter in the plains 5,000 population, one subcenter per 5,000 population in plains, one subcenter per 3,000 population in hilly areas, one PSC 30,000 in the plain, one PSC 20,000 population in the hilly area. Similarly, CSC 1,20,000 population in the plain and one CSC per 80,000 population in the hilly areas. Okay. Staff requirement, subcenter usually 3 to 4 and PSC 32 to 21 and CSC 46 to 52. Maintenance, basically funds. Funds are basically by central government for the subcenters and PSC CSCs by the state government. Okay. Rural area covered 21 square kilometer area covered by the one subcenter, 140 square kilometer covered by the PSC and 770 square kilometer covered by the CSC. Okay, rural distance that is covered 2.6 kilometer, 6.6 kilometer and 15.6 kilometer by the CSC. Usually in the subcenter 4 to 5 villages are covered, PSC 29 to 30 villages are covered and in the CSC 158, near about 158 villages are covered. Okay. What are the staffing pattern of CSC? That was our question. One medical superintendent, medical officer, MBBS, at least MBBS doctor, public health specialist 1, physician 1, surgeon 1, ops gynae 1 because their cesarean section is taken place in the CSCs. Pediatrician is required. Anesthetist is required for the surgeries. Dental surgeon is also required. General duty medical officers, JDMOs are there, and the Ayush post is also there in the CSC. One ophthalmologist is also present in nearby 5 CSCs in the district because once ophthalmologist can travel all the CSCs, he can send to other CSCs for the basically cataract surgeries. Okay. Public health nurse 1 and other staff nurse are 10. Other staff, drivers and sanitation workers should be there in the CSCs. Okay. Each CSC should be a referral center for 4 PSCs. At least 3 to 4 PSCs can send their patient to one CSCs. Okay. And basically this is under the minimum need program. Okay. Another, there is a subcenter, 2 type of subcenter, the subcenter A, subcenter B. Okay. Staffing pattern of subcenters, you can see there. ANM 1 in the subcenter A, 1 health worker male, 1 Safai Karmachari is part-time, total 3 staff. Okay. Subcenter B, what is subcenter A? Subcenter B? Subcenter B is basically where there is a deliveries are taken place at the subcenter. Some subcenters has a ANM is a head, no doctors are at the subcenter. So ANM conduct the delivery at subcenter B. In the subcenter A, usually delivery facilities are not available or sometimes emergency deliveries can take place. So low number of deliveries are there. So 1 ANM should be there. Okay. So ANM 2 required because delivery is taken place. So at least 2 ANM should be there. Sometimes someone is on leave so that another will take charge. Okay. Health worker male 1 full-time Safai Karmachari and total 4. Okay. 4 staff should be in the subcenter B. The staffing pattern at the PSCs. We have taken CSCs and subcenter, now PSC. PSC is medical MBBS doctor should be there. Okay. And sometimes 2 MBBS doctors is required and preferably be LMO. 1 female MBBS doctor should be there. Preferably. If not, 2 MBBS doctors should be at the type B PSC. Because in the type B PSC, we say that more than 20 deliveries are being conducted in the type B PSCs. Okay. If less than 20 deliveries are conducted, it's a type A PSC. Okay. If more than 20 deliveries are conducted, type B PSC, there is the 2 MBBS doctor at least required. Desirable is Ayush doctors as well. Ayush. Okay. Ayush is Ayurvedic, Unani, Siddha, homeopathy, yoga doctor. Okay. It is should be that it's called traditional methods of medicine should be there at the PSCs. Okay. Accountant cum data operator should be there because regularly data should be saved because there are many programs which needs the data collection. So this data operator is very much required at the PSCs. Okay. 1 pharmacist and 1 Ayush pharmacist where the Ayush doctor is there, and a nurse midwife should be 3 at the PSC A and PSC B 4. Okay. Plus 1 as desirable. Health worker female 1, health worker male, health assistant male 1, health assistant female 1, same in the type B. Okay. Health educator is desirable. Laboratory technician is required because some lab tests are also there in the PSCs. Cold chain and vaccine logistics are there. Okay. Multi-skilled group D worker is required. Okay, group D worker is also required there, and sanitary worker cum watchman is also required. Okay, extra one is required as a desirable. So total 13 to 14 staff and 18 to 21 desirable staff is required at the PSCs. Okay, all are true are for PSCs. It covers 30,000 population, right? First referral center, delivery facility available, sometimes available. First contact for the population, yes. First referral center, no. Okay, first referral center is CSCs. Okay, it is first contact of population, you can say that. Okay, in other words, sometimes some teachers have another opinion about this question, that this first contact of population is sub center. Okay, but if question is related with the doctor, so first doctor is basically at the PSC. Okay, and this is first referral center, sometimes it is first referral unit, so it is CSC. Okay, so if it is CSC, then it is the right option, and if it is not related with the doctor, then subcenter should be the option here. So this should be the right answer. Okay, so whatever the language of the question, you can opt accordingly. Okay, which of the noise is a health worker at the village level? So at the village level, we all know that Anganwadi worker is usually at the 800 population, Asha is usually in the village 1000 population, and trained by the assistant is also at the village. Okay, this ANM is at the subcenter, and subcenter is usually at the 4 to 5 villages. Okay, so ANM is usually not at the village level. Okay, it's the subcenter level, 4 to 5 worker is there. Okay, before blood transfusion, following are tested. Okay, so what are the blood tests which is done for the before the blood transfusion? So what are the blood screening tests which is done? HIV, SCV, HBV, syphilis, okay, and malaria. This all should be tested on the blood when screen for the blood. And this HIV is basically the transmission of hepatitis A virus is due to the fecal-oral route. Okay, it is fecal-oral transmission, so blood transfusion usually do not screen hepatitis A virus. Okay, a child present with normal height but weight was lesser than expected in height. Okay, so here you can say that a child is present with normal height. Okay, height is normal height, but weight was lesser than expected than height. Okay, so weight is less, height is normal. Okay, weight by height, so weight is less, height is normal, so it is called wasting. Okay, there is wasting and there is stunting. Stunting when there is height is less due to the chronic malnutrition. Wasting is basically acute malnutrition and weight is less. Okay, okay, kwashiorkor is related with the edema. Edema is present along with the malnutrition. It is a kind of a protein malnutrition, kwashiorkor. Okay, and underweight is a common term, it is not appropriate, and the child is underweight here because weight is less, but the best option is wasting. What are the malnutrition indicator? Underweight is low weight for age. Basically underweight is basically for the low weight for age, not weight for height. Okay, so low weight for age is underweight. Underweight may be acute or chronic. Any malnutrition can be acute or chronic. In both cases, child will be underweight. Low weight for height is wasting. This was our question. Acute malnutrition. Height is normal, weight is less. That means chronically the height is growing, but acutely this weight is reduced, so that it is acute malnutrition. Low height for age, stunting. If height is less for the age, it is called stunting. This is usually the chronic malnutrition. Other some classification, Gomez classification, 90 to 110%, 75 to 89, 60 to 74. This is grade 1, 2, 3, 4 malnutrition. 1, 2, 3, 4 malnutrition. Okay, this grade 1 is 90 to 110. Sometimes normal is also included in the malnutrition. So this Gomez classification not very well adopted. Okay, another classification, Waterloo classification, is basically if more than 2 standard deviation of weight for height, it is normal, and if it is less than more than 2 standard deviation, if it is more than 2 SD or between 2 SD to minus 2 SD, then it is a normal limit. Less than 2 SD, it is weight for height. Weight for height is stunting. wasting, and height for age is stunting. Okay, height is less, stunting, weight is less, wasting. Okay, if both are there, so stunting and wasting both, it is in the Waterloo classification. Another classification is Wellcome Trust classification. It is basically for the Kwashiorkor and marasmus. Okay, so Kwashiorkor and marasmus are overlapping features are there sometimes. So if with edema or without edema, weight is less than 60% or more than 60% to 80%. If within 60% to 80%, it is Kwashiorkor, and is less than 60%, it is marasmic. Okay. What are the passports of child healthcare? Passports of child healthcare are basically this growth charts. Okay, growth chart by the David Morley. David Morley developed the growth charts. There are more than 55 types of growth charts. Okay, and here we are looking in the growth charts. This WHO growth chart. This is home based growth chart, basically drawn between weight for age. Okay, and there are two lines we can see here: upper reference curve and the lower reference curve. Okay, though two curves are there. This upper reference curve is dotted lines is for the upper reference curve for the boys 50 percentile. Okay, and this lower reference curve straight line for the girls 3rd centile. Okay, in between this is called road to health. Okay, your weight should be, your child weight should be lies in this. Okay, so we all know that two lines in the WHO growth chart. Upper line is for 50th percentile for boys, lower reference curve which is for the 3rd percentile for the girls. Okay, it basically used for the 5 to 6 year of age. Okay, sometimes this 50th percentile is also called 80% of upper reference curve. Okay, okay, this lower reference curve, this lower reference curve is 80% of the upper reference curve. Okay, so what is the relation between lower reference curve and upper reference curve? So you can say that lower reference curve is 80% of upper reference curve. Okay, so if it is less than 80% of this upper reference curve, lower reference curve, we fall here. Okay, so there is a malnutrition. So there are so many kind of growth charts. ICDS growth chart based on standard deviations, -2 SD, 3rd center for girls. Okay, this also the 3rd center for girls is also known as -2 SD, or sometimes it is in the like that if 3 lines are there, this is +2 SD, this is -2 SD, this is -3 SD. Okay, so this between -2 SD to -3 SD and below 3 SD is a severe acute malnutrition. Okay, okay, so below 2 SD is the malnutrition, up to the -2 SD is the normal, below -2 SD is the malnutrition, and -3 SD is a severe malnutrition. Okay, and this is the upper reference curve, this is the lower reference curve. Okay, there are many types of growth charts. ICDS growth chart based on WHO, MGRS growth chart, multi-centric growth studies, and this is a growth chart usually in the Anganwadi center. Here we can see that this is the normal, this is grade 1 malnutrition, this is grade 2, this is grade 3, and this is grade 4. Okay, you can simply by weight and age, you can simply put the dot weight and age, and you can say that this is our child. Okay, this is our child, this is our child, and you can see here the diagram is there. If your child has a gaining weight, okay, so this is the good indicator. Okay, if you are in the normal but your child is not gaining weight but it is normal, this is also dangerous. Okay, because as per the dot you are lying in the normal, but if you see from the previous weight to the current weight, your weight is not gaining, which is not a normal phenomenon in the child. So weight should be continuously increased in the child. Okay, so this is also dangerous, and when it dips, it is very dangerous, very dangerous. Is it dangerous? This is very dangerous. Okay, now coming on another topic, that is women who is recently delivered the baby comes to the clinic for the contraception plan for next 3 years, best contraceptive would be. So here the catch is the next 3 years. Okay, this next 3 years she wants no child next 3 years. So the best contraception plan is for the copper T, because OCP she cannot take OCP because so many side effects are there. Condoms has a failure rates, and POPs usually are good, but it is also in long term disease also have a side effects. So best for 3 years it is copper T. Okay, copper T is the best for 3 years. If it is asked what is the best contraception in breastfeeding female, it is progesterone only pill. Okay, or when it said which is ideal contraception for breastfeeding female, it is lactational amenorrhea. Okay, usually exclusive breastfeeding females have a amenorrhea, that is called lactational amenorrhea. It is also kind of a contraception. Okay, it is an ideal contraception, not a best. Best is progesterone only pill, but if it is used for the long term 3 years, it is copper T is best. Okay, this copper T, many copper Ts are there, different shelf life is there. Or copper T 380 has a shelf life of 10 years. Okay, so 3 years is good. Contraception and family planning, we say that India was the first country to adopt the family planning as a program. So after the independence, India, the first program that India started, that is the family planning program. Okay, another thing which is important for you, that is Pearl Index. Pearl Index is basically the contraceptive efficacy. Okay, by the Pearl Index we can check which contraceptive is best. Okay, so total accidental pregnancy upon total month of exposure. So we can say in many of the contraceptives have good efficacy, like combined OCPs or copper Ts, or best is sterilization. Okay, so condoms has a large number of failure rate of Pearl Index. So total accidental pregnancy upon total month of exposure into 1200. Sometimes this 1200 is multiplying factor is changed to 1300 when months is changed into menstrual cycle. Menstrual cycle is usually 28 days. So accordingly, the multiplication factor is 1300. Okay. Another, apart from Pearl Index, another indicator which is used, that is called life table analysis. Life table analysis also failure rate per month for use. Okay. It is usually, Pearl Index is usually, the unit is 100 women year. Okay. 100 women year is a unit for 100 women years. Okay. But the life table index is basically for the single productive age. Okay, she is currently married and she is able to reproduce in the reproductive age. So this is eligible for the contraception. So eligible couple is basically eligible for the contraception. Okay, now in India 150 to 180 eligible couples per 1000 population is there. Okay, eligible couple ratio is maintained at the sub center. What are target couples? Those eligible couples who already have 2 to 3 children. This is our first target. Okay, this eligible couple which are eligible for contraception, our target is those who are already having 2 to 3 children. We are going to give them contraception. Okay, so that no more children should be produced. Okay, this CPR is couple protection. Effective couple protection is usually 50%. For IUD is 95%, OCP is 100%, installation is 100%. So accordingly we can calculate how many persons are. So when effective couple protection rate is calculated, so the condom will be used half. Okay, because 50% is there. Okay, some methods of the contraception. Natural method, we all know that there's safe period method. Pearl Index is very high, 60. Basal body temperature method, cervical mucus method called Billings method. Okay, symptothermic method, combination of temperature, cervical mucus and calendar method. All 3 methods are combined. Sexual abstinence method, it is both effective but it is not practical. You can sexually abstain from your wife. Coitus interruptions, it is the oldest method. Lactational amenorrhea. These are the natural methods of the contraceptions. Production of IUDs are basically foreign body reaction. This is the first option should be there. The best method, the principal action is foreign body reaction. Okay, reduce the viability of the gametes. And another thing is sometimes copper is added. When copper is added, this alters the enzymes. Okay, this alters the enzymes system and also affect the cellular mucus. What are the contraindication of IUDs? IUDs, intrauterine devices, contraindications are basically pregnancy. If pregnancy detected, you cannot insert a IUD. Okay, also a history of ectopic pregnancy, because IUD is prone to ectopics. Okay, so insertion of IUDs can develop ectopic pregnancy. So if there is a history of ectopic pregnancy, you should avoid IUDs. Also PID, pelvic inflammatory disease, where there is an infection, you cannot insert IUD. Okay, because in infection, PIDs, this IUD can also increase the infection. Okay, so you should not use the IUDs in the pelvic inflammatory disease. Okay, PIDs is pelvic inflammatory disease. Okay, name branded in the name Antra. Okay, you can also listen this ads in the radios. This Antra is used. Another is NETN is also a intramuscular injection, usually in every 2 months, 200 milligram dose, 2 months. Okay, side effect of this is irregular cycles and delayed return of the normal menstrual cycle. Okay, no implant is subdermal implants. We all know that there is some calistic implants are inserted in the hands. 35 milligram LNG is there, 5 years shelf life. Major disadvantage, because it is an implant, it should be inserted in the skin, so surgical method is there. So most of the people avoid this. Okay, and female should be married, or even ever married. There should be at least one child alive. Okay, and this child should be more than 1 year. Okay, so that after installation, the survival of the child should be ensured. Okay, age should be 20 to 49 year, but age relaxation is sometimes allowed. Sometimes lower age can be done installation if the family is completed. Okay, sometimes in the India, at the 18 years the female is married, and up to 20 years she has 2 childs. Okay, so you can do installation at 20 years as well. Okay, the child can be relaxed. Okay, consent should be there. There is no means forcefully you cannot sterilize anyone. So consent should be there. No past history of sterilization should be there. And spouse, if one of the spouse is sterilized, so there is no need to sterilize the another spouse. Okay, mini lab technique is used by the trained MBBS doctor. Okay, home deliveries of contraceptives by the Ashas nowadays: 3 condoms for 1 rupees, OCPs for 1 rupees per cycle, emergency contraceptive also 1 rupees. Mission Parivar Vikas use awareness about the family planning methods in high TFR. TFR is total fertility rate. Okay, where the TFR is high, Mission Parivar Vikas is used. Okay, there to aware about the family planning methods. Okay, birth space ensure sterilization. After sterilization, if Asha convince any couple to go for sterilization, 1000 rupees should be given. Okay, this is sponge, today sponge used in the contraception. Centroman tablet, Saheli. Okay, also now name under Chaya and Saheli, those both are Centroman tablets. This is Cialistic implant, Norplant. This is Lipis loop, copper T, and third generation IODs. Okay, Marina. These are all about the contraceptions. Now coming on the relative risk, that is calculated in which study. Okay, so relative risk is basically incidence among exposed upon incidence among non-exposed. Okay, so incidence can be found out in the cohort study. Okay, in the case control study, incidence cannot be found out. Okay, incidence cannot be found out at the case control study. So for the cohort study, incidence can be calculated. So cohort study should be incidence should be equal to 1, no effect, more than 1, it is a risk factor. Okay, attributable risk, absolute risk, or risk difference, or excessive risk. It means increase in incidence in exposed minus incidence in non-exposed upon incidence in non-exposed. Okay, another term is used, population attributable risk. Okay, case fatality rate, number of death due to disease upon total case. Survival rate is usually for the prognosis. In the case of cancers, 5-year survival rate is used. Okay, now another thing, blood bag should be disposed in which color? The biomedical waste management. In the yellow bag, human anatomical, animal anatomical waste, soiled waste like cotton swabs, linens. Okay, expired discarded medicines, expired medicines, chemical liquid waste, linen mattress, microbiological waste, cultures, medias, ये सब येलो में, ठीक है. In the red color, recyclable, red is for the recyclable waste and contaminated, basically plastic and rubber. Red is for rubber and plastics like tubings, catheters, that can be in the red bags. Okay, puncture proof bag should be there. Okay, for example, if you have a syringe, this needle is the sharp, this later portion is plastic, it should be in the red bag, this needle should be in the white bag. Okay, blue is for the glasses. So the concept is waste, sharp and metals. Blue is for the glasses and metallic body implants. Metallic body implant is especially used in the orthopedic, dental implants. These are all in the metallic body implants. Although metals in the white, but metallic body implant in the this blue bag. Okay, treated. Okay, in a European country there is a low birth and low death rate. Okay, low birth rate and low death rate. Okay, it is a which stage of demography cycle? Usually fourth stage is called low stationary. Okay, demographic cycle, we all know that there is a phase 1. In the phase 1 there is high birth rate and high death rate. Usually the birth rate is increasing, so it is a expanding population, early expanding phase. Stage 2. In stage 3, the birth rate also become decreasing and death rate also is decreasing, but not at the level, so it is called a late expanding phase. Our India is in the late expanding phase. Okay, India is in the phase 3, late expanding phase. Now European countries in the phase 4, where there is a low death rate and low birth rate, there is stationary of the low stationary phase. Okay, and the phase 5, where there is a birth rate is decline, in the decline, so that the population is decreasing. Okay, it is called reverse demographic. For the kesari dal, we can see the questions. Ban the crop, yes. Vitamin C prophylaxis, yes. Removal of toxin, yes. DC has no use. Okay, DC is given in the file area. Okay, this is arhar dal, this is kesari dal. I have already told you about that. Very similar dals, but in the, you can see in the kesari dal is a rough type of dal. Arhar dal is very smooth kind of dal. Okay. Definition of sociology. Sociology is the study of individual and group in society, interrelationship between human and their behavior. So sociology is the study of individual and the group in the society and their interrelationship between human and their behavior. Okay. Community, it is a social group. Community is a social group with defined boundaries and a common value of interest. It is called community. What is society? Society is a group of individuals who have organized themselves, like you are living in some society. It is a kind of a small society. So it is a group of individuals who are organized themselves and follow a particular way of life. It is a society. Socialization is a process by which we become social. Okay, society is a social structure. Family is a group of biologically related individuals or related through marriage or adoption. Something married, you are married is not biologically related, but it is related through marriage, or sometimes you adopt a children. It is also family. Living in a same house and sharing common kitchen and income. That is called a family. Medical sociology. Medical sociology is basically studies the relationship of medicine to public, social factor in causation, prevalence, incidence, interpretation of disease. So this sociology in the related to the Karl Marx. Okay, communist type of society, the ideologies are there in the socialism. Social ownership of the raising the standard of working class. So basically, for the working class, the standard should be raising the standard of this working class. Okay, socialism is different than the society. Okay, rather than the government in the socialized medicine. What is social medicine? Here, study of social, economic, environmental, cultural, psychological and genetic factors which have a bearing on health. Okay, social, economic and environmental, cultural factors which have an effect on the health. Okay, these are called social medicine. What is social defense? Social defense are those defenses which protects our society. It's a preventive effect, therapeutic and rehabilitative effect. for the protection of society from antisocial, criminal or deviant conduct of man. So that some laws are made. These legal IPCs are basically made to protect the society. So this is called a social defense. So social defense is basically preventive defense. Also sometimes some drunk persons are means a rehabilitation service for the drug addicts. So it is a kind of a social defense. Another thing is social epidemiology. This epidemiological and social survey are merged together. Okay. Social sciences, sociology, social psychological, social anthropology. Behavioral sciences are sociology, social psychology, and social anthropology. These poverty, this migration, this industrialization cause the social constraint to the society. Industrialization, usually when the industry is made, many of the people migrate from the village and lives around the industries as a worker. So these workers are usually living in the slums. So it is a kind of a social constraints. Okay. The slums are made due to these industrializations. Okay. This is the bad industrialization is a good, but there is some bad effect of industrialization. That is the making of the slums. Okay. Social evil is basically smoking, alcoholism, casteism, gender biasness, child labor, prostitution. These are called social evil. Social deviants are drug abuse, delinquency, suicide. These are social deviants. Culture is the topic apart from sociology. More than one doctor opinion is required for the MTP as per the latest regulation of MTP. So new latest MTP. This is the new latest MTP Act. We can see that in the Amendment Act contains unmarried women also covered. So not only married women can do MTP, can undergo MTP. Also unmarried women can also undergo MTP. You cannot deny any unmarried female to that she cannot undergo any MTP. Okay. So initially it was for the married. Okay. Also beyond the 24 weeks, you can also do MTPs. Okay. Only one registered medical practitioner till 12 weeks and 2 up to 20 weeks. It was earlier. Nowadays, 1 RMP till 20 weeks, 2 RMP at 24 weeks, and after 24 weeks it is required. Then it is usually medical board approval. This medical board is usually framed by the DGME. Okay. Or any breach of the women's confidentiality fined up to 1,000 rupees in earlier act. Now there is fine and also the imprisonment for up to the 1 year. So you cannot question. More than one doctor opinion is required for MTP. More than one doctor 20 to 24 weeks. Earlier it was 12 to 20 weeks. Now it is 20 to 24 weeks. Okay. Counseling and screening done for TB in a HIV positive patient in ICT center. Which level of prevention? So let's discuss about level of prevention. There is the primary level of prevention, primordial level of prevention, primary level of prevention, secondary prevention, and tertiary prevention. So in the primordial prevention, the prevention which is usually done for the one from very childhood, means in very early stage. If anyone is not a smoker and you are instilling the thought that smoking is a bad habit, so that means you are basically giving the primordial level of prevention. Okay, primordial is in very early stage. You are giving up and there is smoking environment is there from the child and you are preventing any adult from smoking. That is the primary level of prevention. So when there is a risk factor you are removing, that is primary. But in the primordial there is no risk factor. The child cannot smoke, but you are saying that do not smoke. That means this is a primordial level of prevention. So lifestyle changes from the very early of the child, if it is in the option, that is a primordial level. And primary basically for the specific protection like immunization, okay, like health education for any disease or any causal factor if risk factor is removed. Okay. Secondary, early examples are here. You can say most of the government programs usually run on the treatment part, that is secondary level of prevention. Although any government program contains primary, secondary and tertiary, all the levels of care. Okay. Patient with more than 2 weeks of coughs at DOTS clinics. So symptom is there, early diagnosis treatment, it is secondary level of prevention. A child is 5 years is discouraged to adopting bad lifestyle. So it is very young child, he is not your health promotion is given, health education is giving, you are giving them to the child that do not adopt a bad lifestyle. So it is a primordial level of prevention. Okay. Spectacles in visual impairment, disability is limited by the specs. So disability limitation is a part of a tertiary level of prevention. Chemoprophylaxis of meningococcal meningitis. What is the chemoprophylaxis of meningococcal meningitis? It is a specific protection. It is a primary level of prevention. Okay. Immunization of disease, specific protection, primary prevention. Okay. Screening of diabetes is screening is secondary prevention. Okay. Sleeping in the bed net, it is a specific protection. It is a primary prevention. Crutches in polio. Polio is already occurred, disease occurred, your disability is limited by the crutches, it's called tertiary level of prevention. So by this method you can easily understand what level of prevention is that. Okay. Exclusive breastfeeding in India 6 months, in the developed nation for 4 months. Breastfeeding up to 2 year and 1 year respectively. Vaccines, medication, vitamin B and D can be given. Energy of breast milk 65 kilocalorie per 100 ml, protein 1.1 gram per 100 ml, and immunoglobulin A is more than immunoglobulin D. Colostrum, we all know colostrum is the rich in, is the first milk, first immunization, rich in immunoglobulins. Okay. Essential fatty acid that is present in iron is given, usually given. Okay. Iron folic acid is given to the child bi-weekly after the 6 month. Okay. Dose is 20 milligram iron and 100 microgram folic acid bi-weekly. Okay. And breastfeeding should be initiated as early as possible, as soon as possible. Okay. This should be the at the delivery table, first choice, as soon as the possible, or 1 hour, and after cesarean section as soon as possible, or up to the 4 hour. So after cesarean section also you can start the breastfeeding as soon as possible. Okay. Richest source of thiamine is highest in the gingerly seeds. Golden rice is genetically modified crop, is rich in iron and vitamin A. Eggs are the poor source of carbohydrates and vitamin C. This is your FMG questions. Okay. These all are your FMG questions. Listen carefully. Okay. Eggs, carbohydrates and vitamin C's are deficient in eggs are deficient in carbohydrate and vitamin C. Milk is deficient in iron and vitamin C, and meat is deficient in calcium. Fish are deficient in carbohydrates and iodine. Iodine is sometimes in the sea fishes, iodine is there. Okay. Iodine is present in sea fishes but not in the river fishes. Okay. A group of organized mass gathering on hand washing awareness, logical sequence will be. So you can see here what is the adoption process. Adoption process, there's first of is awareness. Then by awareness you make start interest, people taking interest in the your awareness program. Then people after showing interest, they will evaluate your thing, if it is right or not, then they will try that and adoption. Okay. So awareness, interest, evaluation, adoption. Trial is the missing in this part. Okay. So any adoption process follows these steps. A 2-year-old child is brought to the PSC OPD with a fever and a cough since last 2 days. On example, chest syndrome is present, respiratory rate is 38 per minute. So 2-year child, 38 per minute respiratory rate, and chest syndrome and respiratory rate is 38 per minute for the 2-year child. For the 2-year-old child, 38 per minute is not the fast breathing, but chest syndrome shows that is a pneumonia. Okay. So you can see here fast breathing. What is the definition of fast breathing? More than 60 respiratory rate in the child up to 2 months. Okay. Less than 2 month child 60. 2 month to 12 month 50. 12 month to 5 year 40. Okay. Here is 38. So fast breathing is not there. We can say that it is no pneumonia but classification. Okay. This new classification says that if simple cough and cold, no pneumonia is there, then it's called home care. Okay. Fast breathing or chest syndrome, oblique chest syndrome. Okay. So chest syndrome is there, that means pneumonia is there. Yellow color category, and 2 months to 59 months, that means 2-year child. oral amoxicillin and home care advice. Child should not be admitted but should be given antibiotic and follow up. Okay. If general danger signs, severe pneumonia or very severe disease there, then refer the child to giving the first antibiotic therapy. Okay. A person accidentally working in the industry lost his hand, he is unable to do his work. What is the inability is called? Okay. Disability is due to loss of foot, he is unable to walk. And handicap, he loses job. Okay. So here in the question, accidentally working in the industry lost his hand, he is unable to do his work. What is inability is called? It is called disability. He is unable to do his work. Okay. Question is this. Lost of his hand, it is impairment. Accident, impairment, but he is unable to do his work. So it is disability. If it's called that he loses his job, so if he loses his job, it is handicapped. Okay. A wide range of values are present in community. Best measures of central tendency will be. Okay. So wide range of values means, wide range means 1, 2,000, 5,000, 6,000, all are given. The best measure of central tendency will be median. Why? Because if range is wide, so there will be overliers, means very highest value and very lowest value should be there. So to find the mid values, you have to take median. Okay. In the wide range of values are present, median should be there. If close range of values are present, mean is better. Okay. If I'm not given this also, this is wrong. So median value should be the actual answer. Okay. So median should be taken between this. Okay. When there is so much variation in the data, median should be taken, and if there is no variation is not very much, so mean can be taken. Okay. SSP is subacute sclerosing panencephalitis. Okay. Subacute sclerosing panencephalitis, SSP, is basically a rare complication of the measles, usually 7 to 10 years after. Some immunization related knowledge. All live vaccine can be given except yellow fever vaccine. Okay. Okay. All live vaccines are contraindicated except yellow fever vaccine. Okay. In the pregnancy, yellow fever vaccine can be given in the pregnancy. All live vaccines are contraindicated in the pregnancy. Okay. Also, live vaccine cannot be given in immunosuppression, also in the corticosteroid therapy. So live vaccine should not be given in pregnancy, corticosteroid therapy and immunosuppression. Okay. Yellow fever can be given in pregnancy. Okay. Yellow fever and cholera vaccine cannot be given together. There is interaction of these two vaccines between. So yellow fever and cholera cannot be given together. Typhoid vaccine is contraindicated in fever. Vaccine contraindicated in preterm mature baby is hepatitis B vaccine, less than 2 kg body. It can be given in CP. CP means cerebral palsy. It can be given because cerebral palsy is already damaged. Brain is already damaged. So there is no need to withdraw the pertussis. Vaccine contraindicated in HIV, asymptomatic HIV. None vaccine is contraindicated in symptomatic. If CD4 count is low, so all live vaccine is contraindicated. Except some vaccines that can be given, MMR, varicella and zoster should be given in the HIV symptomatic as well. Okay. Due to the risk benefit ratio. Paralytic polio by the P3 vaccine and vaccine derived poliovirus by the P2 oral polio vaccine. Okay. Shock in the case of diphtheria, pertussis, tetanus, DPT vaccine and pertussis. DPT also contains pertussis. Hypersensitivity by any vaccine, most commonly by the hepatitis B and meningococcal, DPT and DT. This is a national immunization schedule, and nowadays another some vaccines are added in this schedule, like fractionated IPV in the this 9 month. Okay. First dose, birth dose. 6-week OPV, pentavalent contains DPT, hepatitis B and Haemophilus influenza B. Okay. Also fractional dose of IPV, 1 pneumococcal conjugate vaccine and rotavirus. Okay. The 10-week OPV pentavalent rotavirus and 14-week OPV pentavalent rotavirus as well as FIVB and PCV2 का second vaccine. Okay. And in 9 to 12 month, this measles rubella first vaccine, JE in the endemic districts, and PCV booster along with the FIPV booster. Okay. 16-24 measles rubella second dose and JE second dose in the endemic district. Diphtheria pertussis DPT ka booster, then OPV booster, and the 5 to 6 year DPT booster, and at the 10 year tetanus diphtheria toxoid. Earlier it was TT, now it is TT. Our United Nations. Okay. Okay. Sustainable Development Goals. These are Sustainable Development Goals. First goal is no poverty. Second is zero hunger. Third is good health, well-being. Fourth, quality education. Fifth, gender equality. Clean water and sanitation. 7, affordable energies. 8, decent work and economic growth. 9, industry. 10, reduce inequalities. Sustainable cities and area of interest is third goal. Third goal has this. You can see here 3.1 is this our target. 3.1 2030 MMR by less than 70, 2020 and neonatal mortality rate 12 per thousand, under 5 mortality rate 25 per thousand. By 2030 AIDS, tuberculosis, malaria and neglected tropical disease, hepatitis, waterborne disease, these should be target 3.1 to 3.9 in the sustainable development goal. Okay, I've already told the target in the 2030. NTD, these all should be reduced. Hepatitis also on common waterborne disease. Okay. Some international agencies are there. World Health Organization, established in 1945, 7th April 1948. So 7th April is also celebrated as World Health Day. Okay. In India, headquarters is in the New Delhi. It is a non-political by the United Nations. Our Planet, Our Earth 2022 theme. This is WHO logo. What is UNICEF? United Nations Children's Emergency Fund. Headquarters in New York. GOBI FFF campaign is G for growth monitoring, O for oral rehydration, breastfeeding, immunization, female education, fertility and food for the females. Okay. So these F for basically for the females. Okay. This family planning. International Health Assembly, International Labour Organization Geneva, International Red Cross founded by the Henry Durand, headquarters in Geneva. Food and Agriculture Organization headquarters Rome, Italy, run by the FFSC, Free from Hunger campaign, FAO. International Health Regulation, IHRs, by the WHO, came in 1969. It is revised in 2005. Immediately notifiable diseases are smallpox, wild poliovirus, and human influenza and SARS. Okay, these should be notified immediately within 24 hours. Potentially notifiable diseases are public health important like cholera, plague, yellow fever. Biological, person comes with the right eye with 6/60 and left eye with 3/60. Which type blindness he has? So blindness classification is also important for the FMG. So let's see the classification of the blindness. In the ICD, vision impairment is divided into two groups: distance and near vision. Distance vision, mild vision impairment, visual acuity less than 6/12 to 6/18, moderate 6/18 to 6/60, severe more than 6/60. Total blindness is absolute blindness, light perception negative. Legal blindness is less than 1/60. Social blindness is 3/60 to 1/60, and economic blindness is 6/60 to 3/60. Okay. Moderate visual impairment is 6/18. So our question is right eye 6/60, left eye 3/60. So our vision is 6/60. 6/60 is low vision. Okay. Social blindness is 3/60 or diminution of field vision 3/60. Okay. Manifest blindness is 1/60. You can see the economic blindness. Inability to person to count fingers from a 6 meters 20. This is National Program of Blindness, Right to Sight 2020, WHO, and it has given this Vision 2020. Okay. Patient categorized on the basis of color coding disaster management is, that is called triage. Okay. Color coding disaster management. In the triage, Red color, immediate, within 6 hours, 0 to 6 hours, you need correction, otherwise patient will die. This can be delayed from 6 to 24 hours. Yellow, green, ambulatory patient, you can delay beyond 24 hours. And here these are already died patient, okay, already dead patient or they are going to die, okay. So your intervention do not affect the outcome in the black patient, convert into red after some time. So you need to look after them after this red is taken care of. Yellow fever vaccine is, earlier it was 10-year viability, now new definition accordingly, it is lifelong viability is there, lifelong validity is there, okay. Validity is of this vaccine is now lifelong. Kupusomi scale contains income, education and occupation, okay. These three are income, education, occupation in the Kupusomi scale. Shoshomi BPL criteria, modified Kupusomi education, occupation and income, all in the head of the classification are Udaypari classification. It is income independent classification. There are 9 parameters: caste, occupation, education, land, social participation, family member, house, farm power, in material possession. These are all important in the rural areas, so that's why Udaypari is best classification in the rural areas. Apart from that, modified BG Prasad classification is also used. It can be used in rural as well as urban. It is only income based classification, okay. Simply income less than 500, okay. Fluoride content should be less than 1 ppm, nitrate should be less than 45, nitrate should be less than 3 milligram, alpha activity should be less than 0.5 becquerel, or beta activity should be less than 1 becquerel. Chlorination, Horox chlorine demand, chloronome, mixing of regular dose of chlorine. This chlorinator is used for the mixing of the chlorine, okay. Chloroscope measures the residual chlorine. OT test for the free and total chlorine, and OTA test for the free and combined chlorine. HOCl is the main role in disinfection and hypochlorite is the minor role in disinfection, okay. What is breakpoint chlorination? When there is a residual chlorine start to appear in the water, it is called breakpoint chlorination. What is the contact period? It is 1 hour for the after the addition of chlorine. 1 hour should be the contact period, should be the water. After that 1 hour, water can be used, okay. Before that, water is not disinfected properly. Drinking water quality, 0.5 ppm should be the free residual chlorine should be there, 0.5 ppm. Post disaster, 0.7 ppm, and in the swimming pool 1 ppm should be there, free residual chlorine, okay. This is the free residual chlorine levels, okay. This is recommended. 2.5 bleaching powder, 2.5 gram bleaching powder required for the 1000 liter of water to disinfect. Normally 1000 liter water, it can be disinfected by the 2.5 gram of bleaching powder, okay. What is hardness of the water? It's the soap destruction power. It is temporary by the calcium magnesium bicarbonates and permanent by the calcium magnesium sulfate, chloride and nitrates, okay. 1 milligram hardness is 50 milligram or 50 ppm. Softening is recommended more than 3 millicurie, okay. So 1 to 3, you hard water is better water, but it should be moderately hard, not severely hard. So up to the 1 to 3 hard water you can use. More than 3 millicurie you should use for softening, okay. Bacteriological indicators, coliform count is the most reliable indicator of the basically the fecal contamination of the water, okay. E. coli is most important. Fecal streptococci shows recent contamination, and Clostridium perfringens shows the remote contamination, okay. MPN tubes are there, most of our number tubes for count of chloroform. McConkey lactose bile salt broth, the promocosol brew, ये सब यूज किया था इसमें, ठीक है. The air quality index, green 0 to 50, it is a good air quality index. Moderate 51 to 100, unhealthy is the 100 to 150, and unhealthy red is 150 to 200, okay. Very unhealthy is 200 to 300, and hazardous is 300 and above, okay. So this is air quality index. You have to learn this table, air quality index. This green is basically satisfactory, okay, and this moderate yellow is air quality is acceptable, okay. Some people may experience some injuries, and in unhealthy, this sensitive group is unhealthy. 100 to 150 for sensitive group. For the asthmatic people, this is unhealthy, and this unhealthy red is 151 to 200. Everyone, normal person can be affected by this, or very unhealthy, increase to this health effect increase to everyone, and hazardous is everyone is likely to be affected. Okay. Sound level, auditory fatigue at 90 decibel, more than 90 decibel, 4000 hertz frequency, tolerable limit of noise in less than 90, permanent hearing loss can be occurred at to above 100 decibel, tympanic membrane can be ruptured about 150 decibel, hospital ward limited is 20 to 35 decibel, classroom limit is 40 decibel, library limit is 35 to 40 decibel, whispering is 20 decibel. Separation of apparently healthy people more than period of incubation period is known as quarantine. Okay, isolation is for diseased one, quarantine is for healthy one. Okay, up to the period of incubation, and isolation is a period of communicability. Okay, isolation for the period of communicability and quarantine is for the healthy individual for the incubation period. Okay. Following the steps of investigation, first step is the verification of diagnosis. Whenever there is an epidemic, you should confirm the epidemic, which verify the diagnosis. Okay. Confirmation of existence of epidemics should be if the epidemic is more than 2 standard deviation from the normal occurrence of the disease. If the disease is more than 2 standard deviation for the normal occurrence, then it's called as epidemic. Okay. Then we will define the population at risk, whether it's child, elderly, or both. Okay. Rapid search for all cases, medical surveys, epidemiological case sheet is filled, data is analyzed, and formulation of hypothesis is made, and then evaluation of ecological factors is done. And this cycle is repeated again. Okay. So that more data is collected. Testing of hypothesis, evaluation of ecological factors, further investigation, and writing the report. In the biostatistics, there is some quantitative data and qualitative data. Quantitative data in the numbers and qualitative data in the quality. Okay. So the quantitative data, the quantity shows by the histogram, frequency polygon, frequency curve, line chart, cumulative diagram, scatter diagram. And quality data by the bar diagram, pie diagram, pictogram, and map diagram. This is the bar diagram. Bar diagram is boys and girls, number of boys and number of girls. Okay. Bar diagram is the quality diagram. Okay. The quality data. Okay. It is like histogram, but histogram don't have gaps. Okay. It is continuous. You can see here, this is the histogram, this is continuous. Okay. Number of women and hemoglobin, MCSC, mean corpuscular hemoglobin concentration. These are both are numbers. This is also number, this is also number. This is number, this is boys and girls, this is the quality. Okay. This is a bar diagram, this is a histogram. So you should know the difference between the bar diagram and histogram. Okay. Frequency curve, simply if this middle dots are combined, you can found the frequency curve. Okay. Cumulative diagram is called ogive. Ogive is simply cumulative frequency. For example, the frequency is 1, 3, 4, 5. So cumulative frequency will be 1, 4, 4 plus 3, 7, 5 plus 7, 12. Okay. Number 1, 3, 4, 7. Cumulative frequency 1. Here is 4. Here is 8. Here is 15. Okay. This is the cumulative frequency. So likewise, cumulative frequency is always ascending because lower number is always adding this number. It's called cumulative frequencies. Okay. Frequency polygon, I've already told that this frequency curve and frequency polygons have similar things. Pie diagram, sector diagram, total 100%. Some say yes, 80%, 20% says no. This is the pie diagram. Okay. Another sufficient component cause model is there, which is very much related to this, but this is not a pie diagram. It is sufficient component cause model in which if any disease occurs, okay, if any disease occurs, there is a one cause which is very important. If this cause is removed, then disease will not happen. That cause is called sufficient causation model. Okay. For example, for TB, tubercular bacilli is sufficient cause. If TB bacilli is not there, TB is not there. Okay. Environmental factors all are there, but TB bacilli is not there, then TB will not occur. Okay. So that is called sufficient component cause model. That cause is removed, then disease will not occur. Okay. This is map diagram, which is usually used in the geographical area from where the cases are reported more. For example, this is the area in this city where the more cases are reported. Okay. This is line diagram you all seen in the cricket matches. You can see the line diagrams. Scatter diagram is for the correlation. Weight and height, if they are more close, that means they are related. If they are dispersed, that means it's not related. Okay, correlation is if daughters are very much close, that means related. Is dispersed, it is not related. Pictogram, a picture is given, it's called pictogram. Parametric test is for the normal distribution and non-parametric test for the non-normal distribution. Parametric test is for the quantitative data and non-parametric for the qualitative data. It compares the mean and standard deviation like student test, student t-test, ANOVA test, and non-parametric tests are chi-square test, sign test, and Wilcoxon test. It basically compare percentage, proportion, and fractions. The two types of samplings, random sampling and non-random sampling. Random sampling is called probability sampling or non-purposive sampling, and non-random sampling is called purposive sampling or non-probability sampling. So, in the random sampling, you select no, you are not biased. Randomly, you select anyone. Okay. So, and everyone in the classroom or everyone in the population has an equal chance to be selected. So, it can be simple random sampling, but by simple cheat method. 10 cheats are all in the box, and you select one cheat. Okay, you do not know whose number is this. Anyone can be out of 10. Anyone can be selected. Okay. Systematic random sampling is a sequential technique in which there are houses, and if third house is taken and the next house should be taken. For example, just systematic interval is 5, then 8, then 13, then 18. This is a kind of systematic thing. Okay. Stratified, you make stratas like in the religion, Hindu, Muslim, Sikh, Christians. According to the proportions, the sample is taken. So equal representation of all the population is there. That's why stratified sampling thing. Okay. Multi-stage sampling is when you select state in the state, you select district randomly. In the district, you select blocks randomly. In the blocks, you select randomly the villages. So in that type, you select the multi-stage random sampling. And clustered random sampling, it is usually used 30 cluster techniques in the immunization. Immunization Survey of India use 30 cluster technique, in which clusters are heterogeneous populations. In the stratified sampling, these clusters are homogeneous. When the cluster sampling, these groups are heterogeneous, and we select 7, 7, 7, 7 from 30 clusters, total 207. Okay. So randomly, these clusters, heterogeneous clusters, in the 7 people is 7 child is taken for immunization coverage to check the immunization coverage. So it is called 30 cluster technique. Okay. This is normal distribution. Normal distribution is a bell-shaped curve. The line should not touch the hair. Okay, it should be like this. 2 standard deviation, 95% population, plus minus, either minus, either plus. Okay. Minus 3 SD to minus 3 plus 3 SD is 99.7% population. Okay. And 1 SD minus 2 plus minus 1 SD is 68% population. Okay. Mean, mode, median is equal, all coincide in the normal distribution, and standard deviation is equal to 1. Variance is also 1. Okay. What is nominal order intervention ratio scale? Nominal scale is black white, name wise, black white, male female, it nominal ratio. Ordinal means order, mild, moderate, severe scale. Interval scale like Celsius scale, there is a number sequence, but they are not actually for example, degree Celsius 1 and degree Celsius 2, they're not at 2 degrees Celsius, not twice of 1 degree Celsius. It is more than 1 degree Celsius, but not twice. So this type of scale is called interval scale. Ratio scale like Kelvin scale, where 1 degree Kelvin and 2 degree Kelvin. 2 degree Kelvin is twice of 1 degree Kelvin in heat. Okay. So this is called ratio scale. Okay. Statistical error is called type 1 error and type 2 error. What is null hypothesis? Null hypothesis is whenever you select an hypothesis, for example, drug A and drug B has no difference. It is called no difference. It's called null hypothesis. And if it is true and you do not reject it, you not rejected it, that means you would have done right thing. So no error. And if null hypothesis is not true and B has a difference and you rejected it, so you have done no error. Okay, you have rejected that. Null hypothesis is false and we have rejected that. This is no error. But if null hypothesis is true and you wrongly rejected it, that means you have done a type 1 error. Okay, type 1 error is also known as alpha error. Okay, means null hypothesis is true but you have rejected that null hypothesis is not true. And type 2 error is beta error. When null hypothesis is wrong, means A and B is not correct and you say A and B is not same, but you have said it is same. You are not rejected it. Okay, so it is called type 2 error or beta error. Okay, measure of standard deviation, mean, mode, median. We all know that mode is most repeatable number is mode, mean is sum of all numbers upon number of observation, and median is we arrange in the ascending order, and after the arranging in the ascending order we talk the mid value. What is the 50th percentile? That is the mid value. In the odd number it is easy to find out the mid number. In the even number we take middle two numbers and average of these two numbers will be the median. Okay, skewness, rightly skewed means tail is from the right, left skewed means tail is from the left side. Okay, if rightly skewed, in the right skew, in the left skew, in the right skew, mean is greater than mode, mean is greater than median, and it is greater than mode. Okay, so mean is largest in right skew, and in the left skew mode is highest, then median, then mean. So mean is lowest in left skew. Usually we in the normal distribution there is no skewness. If this is not normal distribution, it is this is right skew, this is left skew. Okay, measure of dispersion is standard deviation, variance, range. These are measures of dispersion. This is the formula of standard deviation. Standard deviation is equals to summation of x minus x bar. X bar is mean. Okay, individual value, summation of all the values, we square root and under root and square this value, n or n minus 1. Okay, n minus 1 when data is less than 30, when it is more than 30, then you will take n. Okay, validity and reliability. When the data, when any observation is repeated, okay, repeatability of the data is called reliability. Okay, the data is repeated. Okay, but it is not valid because it is not in the center. This is the true value. If the data is repeated and in the true value is there, it is both reliable and valid. Here the data is not repeated and the not in the central. Okay, so it is not valid. Okay, when data is not repeatable, not in the center, it is non-reliable and invalid. Okay, and sometimes if data is repeated in the center, also in the periphery, so data is sometimes valid but not reliable. Okay, so reliability is repeatability and validity is closeness to actual value which we need to calculate. Okay, there are some occupational diseases. We say that if any respiratory particle which is more than 10 microns, it is settled down by the gravity, it has no effect. Less than 10 microns suspended in the air, which affects in our respiratory column. 5 to 10 micron in the upper respiratory tract, 3 to 5 micron in the mid respiratory tract, and 1 to 3 micron in the alveoli and settle there. This is more dangerous. Less than 5 micron shows the Brownian movement. Silicosis, silica dust. Anthracosis, coal dust. Asbestosis, asbestos dust. Bisonosis by the cotton vapor. Bagasosis by the molasses, sugarcane. Berylliosis for the beryllium, Farmer's lux moldae, Siderosis R&S, Stanosis stannum tin, bud francis lens AV bud droppings, compost lung by the compost. Okay. We all know that in the bagasosis, which is for the bagaceous sugarcane, antigen is Thermoactinomyces sacchari, this is the fungus. Farmer's lung by the Microspora fani fungus, compost lung by the fungus Aspergillus, and chemical worker lung by the isocyanate chemicals. This asbestosis can cause cancer, mesothelioma. Arsenic can cause skin cancers, lung cancer, and liver cancer. Benzene can cause leukemia. It is the question. Benzene cause urinary bladder cancer. It is a dye. Aniline also. Okay. Benzene dyes are basically related to the urinary bladder cancer. Beryllium by the lung cancer. Cadmium lung cancer. Chromium nasal sinus cancer, lung cancer. Ethylene oxide lung cancer, leukemia. Ionizing radiation by the skin and thyroid and lung. Nickel nasal sinus and lung, polycyclic hydrocarbons skin and scrotum and lung, radon lung cancer, silica lung cancer, vinyl chloride liver cancer, and wood dust by the nasal sinus. Okay. Now coming on some management techniques. So we will take some important management techniques. Cost benefit analysis. Cost benefit analysis basically when there is a cost and you have monetary benefit from this. So it's called cost benefit analysis. Another analysis is cost effective analysis. So in the cost benefit analysis, basically in the corporate world, in corporate hospitals, we take how much amount of money we are getting from how much is spending the money. Okay, but in the government sector, we basically focus on the lives. So what approach has more effective in saving lives? That is called cost effective analysis. Means how much money is spent to save how many lives. This is called cost effective approach. Okay. Network analysis. Network analysis contains PERT, program evaluation review techniques. It is a network analysis used for control of time and cost in complex program like this PERT. You can see here trained staff is there. Okay. If you are starting any service, you have to order the equipment. Like for example, any woman is making the food. So he making dal, chamal, roti. All the things should be made in that manner that all of the food are warm at the same time, made at the same time. So that everyone can eat the warm food at the hot food at the table. So likewise, in the management, any program should be made in that manner that so many things are required. Staff, training and equipment are required. License is required. So all things should be done in that manner that all things should be in there. Thus all should be completed simultaneously. Okay. You cannot do that thing that you have hired a staff, then we wait for the equipment, then we install the equipment, then we start the training. This is not the way. You have to plan the service. Staff is recruited and trained, equipment is ordered, equipment installation in the parallel wise, and the service is started. It contains, this is called a program evaluation review technique. Okay. In this critical path method is there. The longest path is called critical path. Okay. For example, here this 10 months is the longest path. If this path is delayed, overall the project is delayed. Okay. Because it contains 2 months, 4 months, 2 months, 1 month. These can be delayed. It can be to 2 months, it can be to 3 months, it can be to 5 months. But total project is dependent on this 10 months. If this 10 months is delayed, the overall project will be delayed. So that is called critical path. Okay. Critical path method. Okay. The longest path of any thing, that is called critical path. If it is delayed, the whole project will be delayed. Okay. What is Niti Aayog? The Planning Commission is not functional. Now Niti Aayog is replaced the Planning Commission of India. Okay. This is the Niti Aayog for National Institute for Transforming India. The organization has its website that provides the citizens all information related to the commission. Okay. This is the recent data of 21-22. Infant mortality 30 per thousand, maternal mortality 113 per thousand, 113 per lakh, under 5 mortality 34 per thousand, neonatal mortality 23 per thousand, perinatal mortality 22 per thousand, stillbirth rate 21 per thousand, crude birth rate 19.7, crude death rate 6.0, human development rate 6.45, our rank is 131, Multi-dimensional poverty index 0.123, rank is 62. Our country has 27.9% people as poor. GDP per capita $1,900, 1,26,000. Total fertility rate 2.1 according to NFHS 5. This is the latest NFHS 5 about 2.1. In near about 17 states we have 2.1 TFR. Okay, that was our goal. This is the antiretroviral therapy regimen post exposure prophylaxis by the HIV. So if anyone is exposed by the needle injury, so it should be started on the ART within 2 hours or with maximum 2 hours, 72 hours. Between 2 to 72 hours, you have to start the antiretroviral therapy of that needle stick injury or any exposure of that HIV. Okay. The post-exposure prophylaxis should be given to 28 days, irrespective of the regimen. Whatever is the regimen, you have to give the 28 days. Okay. In the adolescent and adults more than 10 years of age or 30 kg, the preferred regimen is TLD, tenofovir, lamivudine, and dolutegravir. Okay. Alternate regimen can be tenofovir, lamivudine, ropinavir. Alternate regimen you can avoid. 6 years age up to 20 years, zidovudine, lamivudine, dolutegravir. So remember the name tenofovir in the adults, and dolutegravir is common in adult, adolescent, and children as well. Okay. Children in less than 6 years of age, less than 20 kg, then this dolutegravir in case of dolutegravir, lopinavir, and ritonavir is used. Okay. Along with zidovudine and lamivudine. Zidovudine, lamivudine in the young age. Okay. Tenofovir, lamivudine, and dolutegravir in the adult age. Okay. Post-exposure prophylaxis in rabies. This post-exposure prophylaxis in rabies is given. 3 categories are, you all know that there are 3 categories in the rabies. Category 1, no skin damages is there. Simply you have to wash. Okay. In the category 2, there is scratches without oozing of any blood. So scratches for wound washing should be there, and vaccination should be given. 2-side vaccination 0 to 7, 1 side or 1 side vaccination 0 to 7. This is the common regimen which is now followed. 0, 3, 7, 14, 28 days regimen. Intramuscular or intradermal. Intradermal regimen is preferred because it contains less dose 0.1 ml and intramuscular contains 0.5 ml. Okay. Immunoglobulin is not indicated in the category 3. Category 3 bites which is all the wounds need washing. Okay. Washing, you have to immediate and washing is required. Immediate washing is required. Then you give 2-side intradermal, 1 side intramuscular or intradermal, or 2-side intramuscular. Okay. These are all the regimens you can give. Along with category in the category 3, immunoglobulin is also given. Okay. Immunoglobulin is also given. Similar, if he is previously immunized, so immunoglobulin is not indicated. Okay. Only change is if he is not previously if he is previously immunized, so immunoglobulin is not indicated, but you have to give the immunization. Okay. So if previously immunized and it is less than 1 year, you simply do not need to give vaccination. More than 1 year, you have to give 0.3. Okay. This 0.3. Okay. So that is all about the important topics, a rapid revision of your FMGE exam. So this nutrition chapter, this epidemiology, and this infectious disease chapter, these all are very important thing. So all the best for your FMGE examination. That's all for today. Thank you.